A very good day to all. Today let's discuss a very important topic, which is hypoglycemia. To know hypoglycemia, first let us learn what is normal blood glucose levels in normal patient and what is altered blood glucose level. So a normal blood glucose level on fasting would be 70 to 110, and on full stomach it could be from 110 to 140. For a diabetic patient, it could be deranged. It could go from 70 to 100 and 126. That would be pre-diabetic range, and from 110 to 180, that could be again a pre-diabetic range. If your sugars goes above 126 on fasting, and if your sugars go above 200 on full stomach, it could be surely diabetes. Get your HbA1c tested and know whether it is whether your diabetes is fully developed and whether you need medications, whether you need treatment. Follow up with your doctors. For now, patients who are already on diabetic treatment, during treatment or during some point of time, they may experience hypoglycemia, which is low blood glucose levels. This could happen when you are newly started on tablets, OHS, which is diabetic tablets, or when you are introduced with a new diabetic medication. Whenever your doctor introduce you, if your diabetes is not getting controlled, then they add on a drug, maybe a diabetic drug. That time you may experience hypoglycemia. If you are weak, if you fall sick, there are during exercise, if you have skipped your meal, there are a lot of reasons where you can experience hypoglycemia. So this kind of events may be very dangerous. Patient, or you may go in coma. Patient may there may even be a death. So to prevent all these accidental things, we have to be very careful. First of all, know your symptoms. When you get hypoglycemia, patient may usually experience anxiety, restlessness, confused. Then very important is profuse sweating, then trembling, shakiness, then nausea, giddiness, blackouts. If you have any this kind of symptoms, giddiness, blackouts, trembling, sweating, immediately, if you have a glucometer, check your sugar and eat something if your sugars are very low. Or else, even if you don't have a glucometer and you know that your sugar is going down, eat something. Even a sweet may be okay for that time, for that period of time. So for this kind of events, or when patient frequently experience hypoglycemia, or when patient who have very high blood sugar, I would really suggest them to go and get a glucometer, which is a diabetes testing machine, which is available in any pharmacy. Take a glucometer of memory and check your sugars regularly. There is a thing called as SMBG, which is self monitoring of blood glucose. You can monitor your blood glucose at home, wherein you can take one notebook, do some columns, write in the first column the dates. The second column would be your fasting blood sugar level. Third column would be 2 hours after your breakfast. Fourth column would be before your lunch. Fifth column would be 2 hours after your lunch. Sixth column would be before dinner, and seventh column would be 2 hours after your dinner. During this time, it's not necessary to do all the checkups on a same day. You can do a pair checkups, like for if you are doing today, you can do fasting blood sugar, and you can check your sugar 2 hours post breakfast. Then next time when you are doing, you can do before lunch and 2 hours after lunch. The next time when you are doing, you can do before dinner and 2 hours post dinner. This will help you in having a controlled glycemic index, and also it will prevent you from getting any hypoglycemia. You would be more conscious. It would also help you if you ate any different kind of food, or if you have any new foods and wherein your sugars get shoots up, so it would make you understand how your sugars are getting high and when is it getting high. Also regularly do your HbA1c testing at least once in 3 months. If it is your sugars are very controlled, then you can do it at least once in 6 months, and all the other blood parameters at least once in 1 year. Do your eye checkups as well. Never stop your medications or treatment by your own. Do visit a consultant. Do see what is exactly happening in your body. Experience the changes. Make a note of those changes. Visit to your doctors or whoever you are consulting, and talk to them and get your problem sorted out. Thank you.